Back, this is The Globe here on SABC News Channel. Thank you so much for joining us. We'll remind you of the stories making headlines in and around your region and internationally in just a moment. But first, let's tell you about this. The South African Society of Psychiatrists saying even though the economy, along with social and physical health impacts of COVID-19 have captured the headlines, the pandemic has also worsened South Africa's already high rates of mental illness and gender-based violence. Studies show that women who are victims of physical or sexual violence at the hands of their intimate partners are twice as likely to experience clinical depression. It further shows that they are at greater risk of attempting suicide. As South Africa marks the annual 16 Days of Activism Against Gender-Based Violence campaign, SASOP says stricter policy interventions and improving stakeholder collaboration are needed to fight the scourge. Global statistics show that 1 in 3 women experience physical violence, mostly by an intimate partner. The United Nations reports that all types of violence against women and girls, especially domestic violence, have increased around the world since the outbreak of COVID-19. In South Africa, 1 in 5 women who have ever been in a relationship have experienced physical violence at the hands of a partner, and 1 in 16 have experienced sexual violence by an intimate partner. All right, to talk more about this, we're joined by Dr. Yumna Minty, who is a member of the South African Society of Psychiatrists. A very good evening to you, Dr. Minty. Thank you so much for speaking to us. Grim figures that we were just highlighting to our viewers there. But I want to fast forward to where we are now. Have we seen any change now that the restriction levels have been lowered, as in there's far more mobility?
Good evening, and thank you for the opportunity. So I think while we need to consider that those restrictive kind of measures that happened with lockdowns may have increased levels of gender-based violence, the problem didn't just start there. So South Africa has been dealing with a problem of huge proportions in terms of gender-based violence long before the COVID-19 pandemic. And it is driven by lots of socioeconomic and social determinants. And even after the COVID-19 pandemic, those problems are still going to be there unless we make some kind of serious interventions in dealing with them.
So what you're saying is that the root causes of the problem, what we should rather be talking about rather than how COVID-19 has worsened the symptoms. So let's just go back to those figures that you've mentioned. Just looking at South Africa, as we mentioned, globally, 1 in 3 women experience physical violence, mostly through intimate partners. But it seems that South Africa seems to rank very high in terms of countries with the highest prevalence of rape and obviously violence at other levels. Why?
So I would describe South Africa as being sort of infamous for these kind of statistics. So just as an example, another statistic is that the rate of murder of females in South Africa is about 5 or 6 times the global average. I read something today that said a woman is raped in South Africa every 29 seconds. And when we consider these statistics, I'm sure you'll agree with me that they are horrifying and they kind of boggle the mind. And like I said before, the problems that have contributed to South Africa having such a significant problem in terms of gender-based violence are quite long-standing. So if we think about them in terms of historical factors and then dynamic factors, South Africa, or democratic South Africa, has inherited the sort of social system or the patriarchal sort of social system that looks at women in a very sort of subjugated kind of position, and these are very entrenched and entrenched attitudes. And coupled with that, South Africa is dealing with a number of other socioeconomic difficulties, which then contribute to the problem. So things like unemployment, poverty, we have high levels of crime and interpersonal violence, not just in terms of gender-based violence. We have low levels of education, and we have high levels of substance use. And all of these problems together are sort of interwoven and cause a significant problem in terms of gender-based violence.
And as you say, some of that is sewn into the fabric of our society, the violence of a system that has created the Group Areas Act, separate, demographic, spatial living. But I'm told that even in our language, we as South Africans are violent. Now, tell me how that has spilled on. As you mentioned, we live in a patriarchal society that really doesn't accord women and children much by way of status. We've seen from the latest crime statistics that the murder of children is also growing. So what is leading to this? We know we already have a problem of gender-based violence and femicide. Why are children now also accounting for those horrific figures in the death toll as a result of this shadow pandemic?
So I think when we look at societies and communities that are in crisis, and we obviously can think of the COVID-19 pandemic as being a crisis, the people who lose at the end of that and the people who get the short end of the stick are essentially the most vulnerable and the weaker in terms of our society. So those are the ones that will bear the brunt of the frustration, the lack of resources, and the fighting for resources. These are the ones who are going to bear the brunt. And these ultimately happen to be our children and our women.
Now, this obviously being revealed within the 16 days of activism campaign against gender-based violence, does it provide any relief? I mean, it's being said by countless activists that it has to be a 365-day campaign. I don't know if it's lack of political will, and we know that despite a summit to discuss this with the president, these activists are complaining that not much has been done. Their suggestions are not materializing in policy changes. Share your thoughts with me around this.
So I agree with you 100%. It is not a problem for 16 days of the year, because this is a reality that women in South Africa face 365 days of the year. And there needs to be effective solutions that we need to look at in terms of dealing with this problem. I think where we can look at the positivities in terms of these 16 days that we use is I think it's a good space, first of all, for planning and organization in terms of the kind of interventions that we need to look at. But I also think that we need to use these 16 days to hold accountable those institutions and those policies that are meant to be assisting women and children, particularly those who experience trauma and violence in our country. And I think it's a good way to reflect on what has been done in the past and look forward to see that more effective solutions can be found.
But Dr. Minty, I'm sure you'll agree with me. We saw that during COVID-19. It was made stark how we as a country have a lack of shelters for women who find themselves in trouble, lack of mechanisms for women to be able to report that they are being abused. Women have died, children have been raped during this time. So when we say hold people accountable, is 16 days enough? And what better collaboration should there be with stakeholders then?
I think that no amount of days is enough considering the extent of our problem. And I think COVID has essentially shown us up and shown the defect and the weaknesses in how we deal with these problems and shown that these are wholly ineffective. And I think part of the problem is that we don't have enough collaboration. So when we look at a problem as complex as gender-based violence and a problem that is rooted in so many different drivers and so many different causes, the solution can't be a simple one, and it can't be one that is undertaken by one agency or just government or just one sort of intervention or one sort of solution. There needs to be collaboration and there needs to be intervention at different levels. We need to look at preventative sort of strategies, so preventing this problem from getting worse and preventing more women and more children and girls from falling into these problems. And we need to look at supportive strategies, so supporting women who find themselves in these circumstances and supporting women who want to get out of these circumstances. We need to look at the economic independence of women so that they don't find themselves in a position where they are at the mercy of men in society. And I think ultimately underlying all of this is that we need to change our attitudes. So the way we view women in society and the value that we assign to women in society is something that needs to change if we have to look at any of these policies having some kind of effectiveness.
It's such a pity we have run out of time, because I really did want us to talk about the mental health effects of all of this, how you say the scars are far deeper than the physical scars, but hopefully they'll grant us time to speak again. But thank you so much for sharing with us